Biology was my natural, it came to me very naturally, unlike things like physics and chemistry.
I've noticed that most girls these days are shorter than they used to be, and the boys are much taller. They're 5'10", 5'11", and girls naturally the maximum height most of us achieve is about 5'3", 5'4", and everyone's not as like.
So there are certain taboos involved with menarche. For example, don't go into the kitchen, don't touch like a
I feel that children these days are living in only the present moment. They say there's one study which they said the scrolling was as tall as the Empire State Building.
Hey everyone, and welcome to another episode of Tete-a-Tete with Inaya. I have a very special show lined up for all of you today, and I am personally very excited because this show is going to be very informative for a wide cross section of my female audience, but especially for young teenage girls trying to navigate Gen Z. So, without further ado, let me introduce my special guests on the show today. They are both stalwarts in their specialized professional fields and have a combined experience of several decades. First up, I would like to welcome Dr. Geeta Mediratta. She is the chairman of Obstetrics and Gynaecology at Sir Gangaram Hospital and an award-winning doctor with nearly 40 years of experience. Dr. Mediratta, a warm welcome to the show.
Thank you.
I also have the privilege of speaking to Dr. Arti Anand. She's a clinical psychologist with over 30 years of experience in the field of mental health and has worked with patients needing psychological intervention. Dr. Anand, welcome to the show.
thank you.
Thank you so much, both of you, for being here. It's truly an honor to speak with people who have done so much for their respective fields, especially when that field is medical science. Okay, so first of all, I'd like to address a very interesting situation here at hand. 16 years ago in 2008, it was actually Dr. Mediratta who brought me to this world. So it's, of course, a very surreal experience for me. And of course, I'm here sitting in front of you, interviewing you. So what's it like for you?
Well, Inaya, let me tell you at the outset, it is a great pleasure to be here and to be interviewed by someone you have actually delivered. So, indeed, it's very nice, and I have to give full credit to your lovely parents, Gaurav and Neha, for bringing you into this world. And I'm truly proud of you. It's really a proud privilege for me to be here.
Okay, so let's start with a more general question, a more general setting to this interview. So, was it always the medical field for you? Did you always want to be doctors, or did you want another profession when you were younger?
Well, as far as I'm concerned, I always wanted to be a doctor since I can remember.
So, like, it was always an interest when you were younger. And Dr. Anand?
I knew that I would be in a helping profession, but I don't think I ever thought I'll be a medical doctor. So after I joined BA psychology, in the final year, I decided I'll be clinical psychologist.
So, why did you have that inkling to become a psychologist?
Because uh, in my college, the teacher, the lecturer was very good in clinical psychology.
Okay.
So my interest grew in that field. And from there on, I realized that a lot of people need counseling sessions. When at that time, this was something very new. So I thought that let me go and do this. And from there on, there's no looking back.
Right. But I have to say, biology is a very daunting subject. All parts of biology, in fact, they require a lot of studying. So, did that seem daunting to you when you started out? Was it difficult, of course, with the amount of studying you had to do?
On the contrary, I think I liked it and I took to it naturally. Biology was my natural, it came to me very naturally, unlike things like physics and chemistry, which didn't come naturally to me.
Right. But I think with biology, you always have to do the other aspects of science. I
Yes,
think that's
yes.
the
And
case
the
with
dissection, I used to
all
always
parts.
enjoy the dissection halls. You know, in the school where you have dissections and all. So I used to always enjoy that.
So, would you encourage other students now to take up biology to become doctors? Is it a good field for people to go into?
Yeah, here I would like to say one thing. You become a doctor only if you are very motivated.
Okay.
If you are willing to spend 99% of your life in the clinic looking after patients, especially the specialities which are clinical specialities, especially like pediatrics, gynecology, surgical specialities, because they need you there all the time. So if you are motivated, only then you take up this line.
Right, that's interesting. Okay. So now let's focus on something that all adolescent girls eventually have to go through, which is menstruation. And it's, of course, a very new experience that most girls have. So, Dr. Mediratta, what would you say is the right age for menarche, that is when periods start? And do you think that girls these days are getting their periods earlier than the previous generation?
Yes, definitely. To answer your second question first, it has been observed that over the years, the age at menarche is shifting.
Right.
It is coming earlier. And due to various reasons, a higher socioeconomic status, good nutrition, and being educated, and then now mothers are having a menstruation menarche, what we call, at an earlier age, so their daughter are also having at an earlier age. Having said that, there are certain areas who are nutritionally malnourished children, who are belonging to poor socioeconomic status. In them we are observing the menstruation start at little later years. But having said that, the average age a girl achieves menarche is roughly around between 10 to 14 years. Actually, it's a whole puberty which starts. Puberty is, if you were to describe it in medical language, puberty has got three parts. One is the thelarche, then the adrenarche, and then finally menarche. The starting of menstruation is the final endpoint. So in this area, a woman becomes sexually mature. Her external genitalia and internal organs become, like, more mature, and reproductive capacity is achieved. So first starts with breast development, then axillary hair, pubic hair, and finally the menstruation starts. And all this time there's a growth spurt. So around between 9 to 15 years, sometimes they can have even 10 11 centimeter growth spurt. So this is, the in a nutshell, the three parts of the adolescence or the sexual maturity, what we call.
So these are warning signs that a girl can use to know that she's about
Yes,
to
and
start.
because your reproductive capacity is now active, so you have to be very careful, especially in girls who are sexually active. They should know in this age group that they can become pregnant. So because the reproductive capacity, though it's not all that at a peak at this age, but definitely this is one thing girls should know.
So, because the age for menarche has shifted quite a bit, do you think there are other consequences that a girl faces because of this shifting of age? Like when she's having her periods when she's much younger. So, are there other consequences that she'll face later on in life because of it, or any changes?
No, nothing. I mean, I don't think there is any consequences of that, excepting, as I said, they should be aware of their reproductive potential.
Yeah.
They should be aware that they are now reproductive capable.
There's one thing I've noticed, that most girls these days are shorter than they used to be, and the boys are much taller. They're 5'10", 5'11", and girls naturally the maximum height most of us achieve is about 5'3", 5'4", and everyone's not as like.
I think the height potential which you reach is a very genetic predisposition. It all depends on your genes. Having said that, the growth hormone, there's a spurt in growth hormone at the time of puberty. So what your grandmother used to say, and growth hormone is produced during sleep. So grandmother always used to say, na, you sleep more, you grow taller and faster. So because growth hormone is secreted during sleep,
Yeah, we grow when we
you
sleep.
grow. So I won't say that they are shorter now, but it's just a genetic predisposition. The same parents, you can have one child very tall and one child very short, depending on the which the tallness gene, how much penetration it is in that. So it won't make much difference.
Right. So I personally feel that there is, of course, a lot of access to education regarding menstruation, but still, when a young girl sees that blood for the first time, it's always something shocking and it's always a traumatic experience. So, Dr. Anand, what advice would you give to such girls and their parents for dealing with menarche and menstruation in general?
See, when you have menarche, menstruation for the first time, obviously there will be emotional and psychological responses. You would not know what is happening to you. So, the first thing that can be done is that the parents can, you know, be there with the child. They can give information to the child, and have an open discussion about menarche. See, when the menstruation happens for the first time, when the adolescent gets menstruation for the very first time, it is very shocking for them. Also, it is an emotional, uh, you know, roller coaster for them because they don't know what's happening. And if you have parents who are with them and standing by them and giving information regarding it beforehand, that will be of a great help. Normally, what happens is parents do not talk about menstruation at home, and it is considered taboo. Okay. Now, if the parents or especially the mother is able to give more information about menstruation and keeps an open communication in the family, it will be more good for the adolescent. Also, certain rituals in the home. So there are certain taboos involved with menarche. For example, don't go into the kitchen, don't touch uh, pickles. All these lead to problems in self-esteem of the uh, adolescent female. They may feel that they are less than others, or there is some problem with them. Having menstruation is a problem, but different, and it is a disease. They may think it is a disease, something I should not have got it. So I think it is very, very important that both the parents should give this kind of information to the child, girl, adolescent girl, that it is a normal process of development, and it is supposed to happen from 10 to 13 years. Every girl goes through it. When you validate the uh, adolescent's feelings and emotions, that leads to a very comforting, that brings them to a comforting zone where they start to accept themselves as they are. They are able to accept that their menstruation is okay and it's fine to be having menstruation. So, this is something very important. Second, very important thing is to maintain proper hygiene. Parents should inculcate proper hygiene to the adolescent female so that she can, be more uh, properly,
Equipped to deal
equipped
with.
to deal with other problems. You know, third, the third thing what the parents can do is involve boys and men of the family members to communicate uh, information or to communicate uh, about menarche, discussions about menarche and menstruation openly. They should also come, men and boys of the family members should also have open discussions,
Right, to be generally aware of what
generally
these
aware,
are.
and they should have a kind of empathy towards their female sisters, siblings, and friends, so that they know that during menstruation they can have pains, mood swings. So, if the family members are aware of these problems, the teenage can also adjust with the problems.
To feel more comfortable.
They can feel more comfortable, and if they have problems, they can easily communicate to their parents or to the family members.
So I'll say that the experience of menstruation does vary a lot from one girl to another. But pain is something that, or discomfort at least, is something that we all experience at some time during our periods. So, Dr. Mediratta, how much pain would you say is too much, or when should a girl know that something is wrong with respect to the pain that she experiences?
So, a little bit of discomfort because when the menstrual blood is passing through the cervix, and cervix is richly supplied by nerves, so it has to dilate a little bit to let the efflux happen. So some amount of discomfort, a little crampiness in the lower abdomen is quite normal. A little bit of low backache, and little pain radiating to the thighs, this is very normal. But if a girl says that she is in excruciating pain, she has to take leave from the school, she has to be taken to the emergency of a hospital for giving IV painkillers, that is a sign for parents to get an ultrasound done, because many times we have seen there is an endometriosis, or there is a cyst, or there are fibroids which are there, and very commonly they are functional cysts also, which just disappear over few months. So that should bring the girl to the gynecologist and have a proper evaluation. But little bit of discomfort, little bit of pain, I think the mother, as Dr. Arti very rightly said, you have to involve the family so that the girl is friends with the family, with the mother, father, brother, sister,
And she doesn't feel an inhibition in sharing
yes,
that she's
absolutely. She should not feel any inhibition in sharing that, look, I'm going through this pain and it's perfectly normal. It's just as normal as digestion, as normal as breathing, as normal as your heart beating. Do you feel embarrassed about your heart beating? Do you feel embarrassed about breathing? So, this is also a physiological process happening in the reproductive system, which is also, I think, we have, as Dr. Arti said very rightly, you have to come to grips with it and understand.
So similarly, with the amount of blood you lose, of course, we all know that we're going to lose some blood during menstruation, but how should someone know that they're losing too much blood? Because again, it's not something that we talk about. I like how many pads
Yeah, I
and
think
stuff.
Inaya, you brought out a very important. In fact, yesterday only in my clinic, I saw a patient with 5 grams hemoglobin, and she's 40 years old. And when I ask her about her quantity of blood flow, she says, "ये तो शुरू से इतना ही चल रहा है." Since I was a small girl, and she didn't know that this is abnormal, and slowly, and she's got married, produced children, and she's always been breathless, very tired. So there
Signs of anemia.
she was severely anemic because she'd been heavily menstruating. So it's a very good question that normally when we do studies, we have found a girl loses roughly around 40 to 80 ml blood in one menstrual cycle, not per day, in the whole 3 days, 4 days, 5 days, and roughly about 3 to 4 pads per day, which is a fair amount of hygiene also looked after. So if any girl loses, heavy bleeding, or if she's passing clots, or if she's soaking more than 7 8 pads in a day, or there is what we call spillage or staining, say she's sitting and there is staining of the sofa or the bed sheet or one, that means it is excessive flow. So these are the things all girls should know.
Another thing I'd say about this is that like we have statistics about how many pads you can use in a day and how much is normal. But I think every girl has different perspectives of when a pad is full and when she should change. Because so with respect to that, like if the pad is completely full or if it's so what would you say about that?
You see, that is another. I think I'm very happy you brought this out, because there are certain now sanitary napkins in the market like Whisper and all, which have that lot of soakage capacity. So they soak and soak, and they are quite full before the girl knows she's soaked too much.
Yeah.
So she would know. Whereas the olden days, the cotton pads would get soaked with say around 10 20 ml, and she would change it. So that's a little handicap they have. But having said that, one should be knowing if they feel like a flow coming out the whole day long, that's a heavy flow. Or if she's passing big clots, that is a heavy, should be considered a HMB or a heavy menstrual bleeding. Or more than anything, more than 7 8 10 pads which are fully soaked. Right. For the sense of hygiene, I've seen girls who change 10 pads in a day, but they are not heavy bleeder, but because they are very finicky about the hygiene. Every hour they change a pad, every 2 hours they change a pad, which is just superficially soaked. So one good idea is having what we call a PBAC, a pictorial blood assessment chart, where you can actually see the stain in the pad and have a rough idea about how much you bleed, so that the next cycle there is a heavier bleed, you have a reference of your previous few years of menstruation, visual picture. So that is one way the girls can know, but definitely clots, 7 8 pads, soakage, spillage, these are warning signs.
How what's the approximate size of a clot and like which you should know is abnormal or which is normal?
You see, there's no size as such, but you see, menstrual blood doesn't clot. It's only when you're heavily bleeding, so clotting mechanism comes into play and the clots are formed. So even if you have, say, 4, 5, or maybe 2, 3 centimeter clots, that is a good size. which should alert you to report to your gynecologist, or anything which you feel is unusual, abnormal, more than your previous
It's a relative.
relative. Yeah.
So now that we have spoken about pads, what do you think is better to use when you're on your periods? Pads, tampons, or menstrual cups with respect to hygiene? Or
Yes, I think that's a very good question. I would say using simple cotton pads is the best, safest, most hygienic thing. However, if you are going to participate in some sports and all, use of a tampon is all right, but for short periods, because we have what we call toxic shock syndrome, TSS, which is a life threatening problem seen with tampon users who have forgotten the tampons. It can happen. It can
Mm.
happen. So that is one thing. And sports women can use it, but for a short time. But preferably use cotton, and be, for the sake of hygiene, 3 4 pads, once in 5 hours, change a pad 5 or 6 hours. And in the nighttime, you can use a bigger size, a larger size pad, so that you don't have to get up in the night.
how about menstrual cups?
Cups, well, for unmarried girls, I won't say it's a good idea, because for the same reason as the tampon, it can get forgotten. It can remain inside, and there's a high chance of vaginal infection with these, and they are very difficult to treat infection. We've had cases where we had to admit them, give them IV antibiotics. So, especially unmarried women. Married women, they can still use, but again, as I said, for a short time.
Okay, so we've talked about menstruation, but now let's focus on the broader background within which menstruation occurs, and that's, of course, puberty.
Now, what happens during puberty? People say that during puberty, every teenager becomes rebellious and has anger issues, becomes aggressive. That's not true. Not everybody goes through anger issues. Not everybody will have mood swings. Not everybody will be rebellious. So this is one myth which is among parents. So this is one very important thing. Secondly, puberty may everybody says uh, that it is uh, it is a hormonal imbalance. It will be fine. No, it is not like that. We have to validate the teenage emotions and physical discomfort. It is basically a stage of puberty which needs adjustment, which needs acceptance from self and from the family members. What happens during puberty? There are many physical changes, there will be emotional changes, and also your perception about yourself and the world around is also changing. So to say that everything is due to hormones is not a fact. Okay, so there are many psychological, emotional, and social uh, roles or environmental factors, many factors that lead to person's changes in the person. Another puberty में जो देखा जाता है that uh, boys are not supposed to, when they grow up, when they lead, when they enter teens, it is said that boys should be tough, they cannot show emotions, and they suppress their emotions. This is one more cliche, or you can say one of the myths or stereotype that is prevalent till date. We see, I get so many cases where teenagers suppress their emotions. Even females also suppress, because sometimes what happens, they are said that she is becoming too emotional because of periods, or because of she is into puberty, isko pata hi nahi chalta kya ho raha hai. So it is not like that. The child or the adolescent is going through so much physically, psychologically, and emotionally. He is not able to understand many of the things. And when you don't have understanding parents, then you will show all kinds of behavioral problems, emotional problems, and it may lead to depression and anxiety also. So we cannot say that it is कि जब आप puberty से बाहर निकलोगे तो सब कुछ ठीक हो जाएगा, ऐसा नहीं होता. Everybody goes through this problem. Many of them may not go through this problem, but if they have some adjustment problems or problems with their self image or their body image or any emotional problem, it has to be addressed. It will not go on its own when the puberty is over. This is a very big myth which is prevalent now. And what happens is when in the families we will not address problems of the teenage, and it will linger it on till the adulthood, and they will have many negative repercussions in their marriage or in later relationship issues.
Right. And you mentioned something very important, which is self image, body image, your confidence, how others perceive you, and being more conscious of that. So, I think that's also a very prevalent factor that comes into play when you're going through puberty. So, do you think there is a connection between this self image and social media, which is now, of course, very popular? Like, it was, I'm sure, having issues about your body image existed earlier as well when there was no social media. But do you think it's been aggravated further because of social media?
Yes, the social, your self image is what you understand by self image is how you perceive yourself, your body, yourself, what attitudes you have towards yourself. That is what is self image. अगर हम in layman language में बताएं. But what is happening through social media, we are receiving body images which are not possible, which are not realistic. To show every time you have to wear best clothes, you have to look a certain way, or you have to have a certain weight. Okay, that pressure teenagers are taking a lot, and it is showing in the form of anxiety disorders, depression, lowered self confidence, and social isolation also. What is happening? The influencers and celebrities are showing themselves on Instagram, TikTok, and other reels which you see as perfect without any flaws.
You're only showing your best side, though.
Best
That's
side,
not always
which
realistic.
which is not true. You cannot be always be smart. You can not look the best always, and you not all of us can have very thin weight, low weight, or look thin like any of the Katrina Kaif or the so-called actresses. Okay, the zero weight concept with zero वो क्या आया था?
Zero size.
Zero size.
Zero
The
size.
zero size figure, which is still prevalent till date, is leading to anorexia nervosa, where eating disorder, that is an eating disorder. It is because every teenager wants to have that zero size figure, which is not possible. And that zero size figure is also may not be true for that person. Maybe through apps you're changing, filtering the filters are very common nowadays. So by filters you can show you're the best. So every teenage, I think, wants to look like the other person, and there is so much of comparison between me and others that they forget themselves, to their true identity, to them, their own self, when they are comparing with others. And this leads to a lot of mental health issues among teenagers.
I would like to add one thing here. Dr. Arti has very rightly mentioned about these filters being put and people being portrayed in a certain shape. So we've had patients who have stopped eating, therefore their fat levels, body fat levels dropped, and we all know that we need at least a 27% fat if you do the body composition to have proper menstruation.
Very true.
So because of that drop in the fat composition, they have become amenorrheic. Amenorrheic is no menses. Then they get worried. The mothers bring them that, since I've sent her to the hostel, because in the hostel, that's when, they're 15, 16, they are going to hostels and all, and their peer group, there's no mother, father, there's a peer group who everybody is seeing those so called filtered pictures of the heroines. Everybody is not eating, they are practically fasting, and they are all amenorrheic. So that's a very distorted way of looking at life. And that is why, again and again, as Dr. Arti has also said, the validation from parents in your formative years, a good communication, a good rapport system, and a trust based relation with your
Yes.
parents is a very important, I should say, it's a foundation block on which childhood, adolescent, and adulthood is made, because these are the girls and boys who will then grow up to become, the better partners for their
Yes,
spouses.
very
They
true.
will become better parents for their children. It's a cycle. So problem is that with all this social media, I think I will very strongly say about this, we have to budget the social media exposure to the children. And I think the parents are responsible for exposing their children to too much social media for whatever reasons. Let's not go into that. But for whatever reasons, the parents are the ones to hold responsible, not the children.
Right. So, of course, we've talked about puberty, we've talked about menstruation and body image issues or problems. Do you think our education system also has a role to play in shaping us to better accept these things or have a better attitude towards these things? Because parents have a role, that's natural. But I think our education system also needs to somewhere down the line be improved. So, what are your views on that?
It is very important that in the education system we can add information or educating the children about puberty, menstruation, and the problems related to, or the not the problems, I can say, the changes related to puberty, so that children are also aware that these are the changes expected. Also, during the curriculum, we should have counselors and psychologists, special counselors and psychologists, to deal with teenage problems. And also, schools should provide safe and open communication for these teenagers without any stigma or ridiculing them, because many of them will not open what is going on in their mind, or what they are going through emotionally. In the school curriculum, there should be strict rules about bullying, self image, and open environment to discuss on these areas also. Many teachers, or till date, shy to talk about puberty, shy to talk about nocturnal emission, shy to talk about menstruation. I think the teachers also should be, you know,
Should feel comfortable.
comfortable. They should also be trained. Actually, teachers should also be trained to deal with teenagers, actually.
I think the role of counselors you mentioned is, I think, a good idea. All schools should have on their rolls a counselor, so that they can refer these children who are having issues about adjustment to the counselor and have a definitive counseling session.
I think in the United States there's this concept of health class that they have. It's a part of their curriculum where they only talk about these issues and periods and reproductive health, sexual activity. That's all they talk about in that class.
And contraception. It's a very
Yeah,
important
contraception.
part
Which
of
has
contraception is a
yes.
very important part um of this. So
Can I add one more thing? Sorry. Because what happens in our society still, talking about premarital sex, or having sex before marriage, is still considered taboo by our parents and in general society also. Abhi bhi hai. So, teenagers are scared to talk to their teachers or counselors, because many of them will judge them also. So, I think uh, counselors and psychologists should also be trained, and teachers also be trained to deal with specifically with puberty, uh, adolescents going through puberty and problems of teenagers. So,
And I think knowledge about these things is
things
very important, because
important,
again, in health class in the United States, they learn about these things.
Be a very
mostly.
non-judgmental way of
judgmental.
teaching them, and not to malign
Yes.
sex. If and always to give them the correct knowledge. As ma'am said about premarital sex, it's always, don't be judgmental, but tell them that, look, sex out of marriage may not be the best thing. If you argue with them or try to convince them, surely they will listen, rather than being judgmental and telling them that this is wrong.
I think in our education system, there is knowledge about our bodily processes, about the biology of it, but there is never information about the consequences or contraception or these things. I think that's where we need to improve.
Yeah.
When it
Very
comes
And
to
the
that.
question about social media you asked was a very relevant question, because it is playing havoc. And now there are studies showing that screen exposure, the light which emanates from the screen, whatever material you are seeing, but the light which is emanating, number one, and the matter which you are absorbing, your brain is absorbing, is not good for your gray cells, your brain cells. They sort of go into kind of like a dementia brain. If you were to see a old man, say 80, 90 with dementia, they're almost similar physiological changes in the brain happening. So you cannot think very rationally. You cannot take decisions rationally. So if you tell the children that, look, there is a screen time, half an hour in a day or maybe 1 hour in a day, and because otherwise, give them the answer, give them the reason why you are forbidding them from that.
I mean, social media or even screen use is it's inevitable. It
It is
has to happen
inevitable,
in
but
today's
if you
life.
use it judiciously and only for your study purpose, and maybe allow 15 minutes of fun time, but instead of having it the reverse. And then biological clock, I see many children these days, they are looking at their social media right till 2 a.m., 3 a.m., scrolling endlessly, endless scrolling. They say there's one study which they said the scrolling was as tall as the Empire State Building.
Oh.
In a day, the scrolls, if you were to measure the scrolls, they were as tall as entire Empire State Building. So that is amazing. I mean, if you're so much scrolling and your poor little brain is bombarded with so much of senseless information. So if you tell your teenager that, look, this is what it is doing to your brain, surely they will understand. Surely.
What's a way to deal with social media or phone addiction once you have it? Like, it's done and dusted now, but I think getting out of that stupor is very important. And oftentimes parents and children, when they know they have to get out of this, they know the consequences it's having, it's still a very difficult issue to deal with.
It's a de-addiction, just as you go for through a de-addiction for smoking alcohol. I think Dr. Arti would be better able to handle that
See,
question.
uh, for this de-addiction, it depends on severity. Okay, there are may have to go in for medication. Antidepressants could be one of the things, with therapy, psychological therapy. What few things you can do is that in your screen, reducing screen play and screen time, and replacing it with some kind of activity. It could be gymming, it could be dancing, it could be any physical activity that will help them release the same dopamine which they were getting from watching their screen reels. Okay, that is another thing. Secondly, maintaining, the whole family has to maintain a screen time for themselves, minimum screen time. Everybody, where everybody will sit and communicate with one another. Communication, involvement in the family time has to be there, because these days everybody goes to work, comes back, and is with their
Absolutely.
screen. So every family member or every family should have this rule that half an hour to 45 minutes we are going to talk to one another. Maybe we will play some carom board, or we will interact with each other, talk about their work, how it was, or simply have tea and samosa together, just to do nothing, because these days to teenagers cannot sit like this,
We can't sit
Sit
still, exactly.
without, so
Something to occupy themselves.
occupy, they have to be occupied, they want to be occupied,
Something that's constantly feeding the brain.
so मैं ये कहूँगी कि use mindfulness techniques, just sit 5 to 10 minutes of sitting idly and just observe yourself, your thoughts, grounding techniques, ठीक है, that is really helpful. I'm not saying do it for half an hour, start from 5 minutes, 10 minutes, all of you can do it together sitting, just meditate, close your eyes and just observe your breathing, how you're breathing, and communicate with each other your experiences. The family as a whole can also do it. ठीक है, एक occupy yourself with certain hobbies,
Yes.
because again you have to replace this with your screen time with certain hobbies.
I think with that there is another aspect that comes into play. Let's say I'm going to paint something, or I'm trying to draw, like cutting down on the screen time. But often I will put on some music in the background while I'm drawing, or like that music is one aspect of it. Let's say I'm listening to a podcast or a video. So there is still that connection with social media. Even like so many things in life you can do while you're also handling social media on the sidelines.
So idea is that only, not to have any social media around. You can just switch off. There is this syndrome that happens, that when you are doing nothing, you still hear some ringing in your ears, कि वो ting आ रहा है, somebody. So that is a part of addiction, internet addiction. When you don't have internet, you still imagine that the phone is ringing, or you are getting some like, or there is a message, sound of a message, curiosity, and also you see कि अच्छा कुछ आ तो नहीं गया, you're rushing towards that. So for 1 hour, if you say that I'm going to switch off my mobile, let me experiment what it happens. You do it for a week, you will realize nothing happens. After 1 hour, जो messages होंगी मैं वैसे ही पढ़ लूँगी, वैसे ही reply कर दूँगी. There's no urgency for me to reply there and then. So these are the.
Sorry, I have a question. These days I find a lot of mothers coming to me and saying that the girls are all the time, dressing up in front of the mirror and, trying to ape the latest, say, fads of dresses or makeup. So this is quite natural. A girl looking in the mirror all the time, I think Inaya will agree with me, that is a very common thing. But when a patient comes to me or to you and says that this is wrong, would you counsel the mother or will you counsel the daughter?
See, I will ask mother how much time she is doing it. If she is doing it every minute, every 5 minutes or 10 minutes, the mother is saying that she is every 15-20 minutes she has to see her hair and then it's a problem. If she's doing once or twice in the whole day or thrice in a whole day, it's okay. Because we all want to look good.
Yeah.
We all want to look beautiful in front of the camera. Am I right?
Yes.
When I'm talking to you on a video, I would want to look the best, na? Even if it's not my boyfriend, I want to look. So that's normal. So I will counsel depending on the situation and intensity of the problem.
Right.
If the intensity and the problem is minor, it is normal, then I'll counsel the mother. Otherwise, I will take a counseling session of the child or the adolescent and find out why she is doing it. What are the reasons of doing it? Is it another kind of a mental disorder? OCD तो नहीं है उसको, ठीक है ना? और कोई एंजाइटी रिलेटेड प्रॉब्लम तो नहीं है उसको, कोई सेल्फ इमेज इश्यूज तो नहीं है, बॉडी डिस्मॉर्फिक डिसऑर्डर्स तो नहीं है कि शी इज़ गोइंग अगेन एंड अगेन चेकिंग हर सेल्फ इन द मिरर. So it depends from the symptoms and
Symptoms.
intensity.
Of course, we've had a very enriching discussion about various topics. Any final advice that you have for parents and Gen Z in dealing with several issues that they face in their
I
lives?
think just be friends with your children. Remember your childhood, remember your teenage, and remember how your parents dealt with you in a very natural way or an unnatural way. There are some people who have had a very unnatural childhood, so at least don't do the mistakes your parents did in bringing you up. And if your parents did the right things, you also do those things. And I think bringing up children is, it's a very natural process. So if you just use a little bit of judgment and a little bit of affection and understanding, we can make it work.
Okay, thank you so much, both of you, for joining me for this episode of Tete-a-Tete with Inaya. I certainly had a wonderful time. There was a lot of information for me also to understand, to interpret, and I'm sure the viewers also had a very enriching time listening to that conversation.
Thank you so much.
Thank you so much for having us. Thank you.
Thank you so much, viewers, for tuning into this episode of Tete-a-Tete with Inaya. I hope you had a wonderful time watching this episode. Don't forget to like, comment, and subscribe, and I'll see you in the next one. Bye.